This mouth problem raises heart attack risk by 50%. It doesn't show up on stress tests. It doesn't show up on cholesterol tests. And it keeps damaging arteries nevertheless, even when everything else looks normal, fine. Because the problem is not in your chest, it's in your mouth. And if you've been brushing, flossing, and doing everything right, this might be the risk you were never warned about, but something you can easily and simply fix. Now, that inflammation doesn't come from plaque in your arteries, at least first. It starts somewhere else. No one connects to heart disease. Your gums, those red fleshy things next to your teeth. And the reason this matters is simple. This kind of inflammation quietly feeds plaque in your arteries every single day, while routine cardiac testing keeps saying that you're fine. Don't rely on just the same old tests. Today I'm going to show you why brushing and flossing aren't enough. The one missing tool that actually changes outcomes. Number 3, a popular natural fix. Natural, and it sounds right, but it just fails. And number 4, the exact 3-step protocol I use to reduce this hidden inflammatory burden. It isn't about dental hygiene so much as it is about artery biology and living a long, healthy life. Why your mouth can drive heart disease. Now, over 40% of adults have gum disease. That condition's associated with a 30 to 55% higher risk of coronary heart disease and other artery clogging vascular disease. And here's the problem. Your cardiologist is not going to look, your primary care doc's not going to look, and the dentist really is going to ignore it. They get up every day, take a shower, eat breakfast, go to work, and they see adult after adult after adult with bleeding gums and dental disease. They see so much of it, and they've been ignored so many times. Sort of like the doctors, the primary care doctors and the cardiologists who graduated from training and said, I'm going to save the world. I'm going to have all these people lose weight, exercise, and sleep well. They run into vast disinterest and they give up. Same thing on the dental side. They see these patients with gum disease after gum disease after gum disease associated with undiagnosed prediabetes, and they work with these people. They try to get them to take it seriously. Like the young doctors, the young dentists just get hit with vast lack of interest, lack of responsiveness in their patient population, so they forget about it. These are not fringe numbers. They come from large population studies and systematic reviews reproduced for decades. Not because plaque from your teeth travels to your heart, but because inflammation does. And when your gums are inflamed, bacteria and bacterial products enter the bloodstream. And inflammation is one of the central drivers of arterial injury and plaque progression. Your cardiologist focuses on labs, scans, medications, stress tests. Your dentist focuses on putting fillings in cavities. No one really connects these two. And really, most people don't even look at the gums that much anyway. So people do everything they're told to do. They exercise, they eat better, they take their meds, and this risk keeps quietly building. Now, here's why most people think they're fine. Most people brush their teeth daily, so they assume their mouth is healthy. Brushing only cleans what you can see, what you're brushing. It doesn't reliably clean between the teeth. It doesn't get below the gum line or inside periodontal pockets between the gum and the teeth. And that's where the most harmful bacteria live. So somebody can brush twice a day, feel responsible, they're doing their part, and still have chronic inflammation of the gums, repeated bacterial entry into the bloodstream, elevated systemic inflammation. So this is why gum disease often goes unnoticed. Remember, this is exactly why brushing alone does not change this risk. Here's the step that most people miss. Brushing cleans surfaces. Flossing helps in tight places, but neither reliably clean below the gum line, where inflammation actually lives. This is the part most people never hear about. It's those pockets, and it's where the risk actually changes. That's where water flossing comes in. A water flosser uses pulsed pressure to flush bacteria out of those periodontal pockets, those gum pockets next to your teeth, areas your toothbrush and floss simply cannot reach. Think of it this way. Brushing wipes the outside of a pipe. Flossing cleans along the edges. Water flossing clears sediment from the corners where buildup keeps coming back. That bacterial biofilm under the gums is not passive. It constantly stimulates inflammation. Clinical periodontal studies show that reducing gum inflammation lowers systemic inflammatory markers and improves endothelial function. Pardon the geek term, improves the function of the lining of the artery. This is the same biology involved in forming plaque. When you disrupt that biofilm consistently, gum inflammation drops. When inflammation drops, systemic inflammation drops. Drop the inflammation in your gums, you're going to drop the inflammation in your arteries. That's what that means. And when you drop inflammation in your arteries, your heart attack risk drops, and stroke risk, and kidney disease risk, and blindness disease risk, and risk for Alzheimer's. This is why brushing and flossing alone just don't change outcomes, even in disciplined people. In a moment, I'll show you the routine that actually lowers inflammatory load. Before we do, I've got a quick geek note for the scientists. This connection between oral bacteria and heart disease isn't internet theory. It's been documented in peer-reviewed work by my good friends, Brad Bale, Amy Doneen, and an even better friend, microbiologist and lab scientist from Vanderbilt, Dave Vigorist. These are all clinicians who focus on inflammatory and infectious drivers of heart disease, not just cholesterol. They've done the Lord's work for decades. Their work helps explain why chronic oral infection can act as a long-term inflammatory burden on the vascular system, and therefore heart attacks, strokes, brains, kidney disease, and erectile function. This is real medicine. It's not just routinely connected in everyday care. Now, this is the full protocol that I recommend. Step 1, brush twice daily. Focus on the gum line. Soft bristles, 2 minutes. That's step 1. Now step 2, floss daily. You just got to do it. Sweep gently under the gum line where you can. Get between teeth. Consistency matters more than force here. And number 3, water floss. Every day. I do it in the evening. Aim along the gum line. That's where those pockets are. Pay attention to the areas that bleed or feel tender. Those are critical areas. That's where inflammation's getting into your arteries. Doing 1 or 2, those 2 steps, those help. But until you get the 3rd, you're not doing what you need to do. Do all 3 steps: brushing, flossing, and water flossing. That's what changes outcomes. If you skip the water flossing, inflammation usually doesn't stop. I know. I'm a poster child for it. Arterial risk doesn't change either. Now, let's be clear about something else. You bring this topic up, and people are always going to talk about oil pulling. Oil pulling does not remove hardened tartar. It just does not. It does not reach periodontal pockets. No, it doesn't. And it does not disrupt established biofilm below the gum line. I know I'm going to get a lot of hater comments for that, but you know what? That's okay. The truth needs to be out there. Some home remedies work for some things, some don't. This one does not. At best, oil pulling alters the surface environment temporarily. At worst, it creates false reassurance, while inflammation continues underneath because the evidence does not support it. If it replaces flossing, water flossing, or professional cleanings, it delays prevention. Okay, what at-home care cannot fix? Once plaque hardens into calculus, and calculus is built by the bacteria that are there, by the way, it's sort of like a reef, a hard reef, built by the creatures that live there. Calcification. No at-home device is going to remove calculus. Trying to scrape tartar at home? That's just not safe. You're going to jab into your tongue, injure your tongue or your gum or your tooth. Professional cleanings still matter, but don't rely on those alone. You got to do the at-home care to reduce your risk. Dental visits catch what you cannot see, and you need both. The big picture? This doesn't matter because teeth connect directly to arteries, but it does matter because inflammation connects everything. Your mouth upstream is upstream. Oral inflammation, if you can reduce that, you reduce systemic, vascular, or arterial inflammation, and therefore plaque, and therefore actually unclog your arteries. Reduce that systemic inflammation and you protect or unclog your arteries. Now that you understand why periodontal disease, gum disease, is linked to heart attack risk and why brushing alone just is not enough, brush, floss, water floss, reduce inflammation, protect your arteries. The next thing you need to understand is how inflammation actually turns into plaque inside the artery wall. Because once you see that process, a lot of standard heart advice just doesn't make sense anymore. That's the video you should watch next. Growing old's not for sissies, but it's a lot easier with healthy arteries.